Today, I'll be talking about epidural steroid injection. Epidural steroid injection, this is the question I get asked all the time. Oh, I got a steroid shot in my back. My pain got better. I got a steroid shot in my back for my sciatic pain. So I get asked this question quite a bit. What is epidural steroid injection? Epidural steroid injection, before we go dwell into what is epidural steroid injection, let's understand something. Let's understand type of back pain that it is usually used to treat. There is a type of back pain that starts in the lower back that shoots down the leg. It is also called sciatica pain. It's also called pinch nerve pain. Usually when somebody is trying to pick up something heavy, heavy object, or trying to strain, holding on to something, you will feel something give in your back. That give is a bulging disc most of the time. And when that presses the nerve, that leads to what is called pinch nerve pain or sciatic pain. So when that happens, patients usually feel a shooting pain going down from the lower back all the way down to the leg. This, when after diagnosing appropriately with physical examination and also with possibly an MRI or a CAT scan or what have you, if your doctor decides that you are a candidate for epidural steroid injection, that is where it is used to treat that. Epidural space is a space above the spinal cord where the nerves come out. This space does not have any spinal fluid. When that space receives a steroid, it goes around, wraps around, and it treats the irritated nerve root that's going down the leg. Usually this treatment is employed before any surgical intervention or a surgery to the lower back. How is it done? It is done in an operating room type of setting where you lie down on a table on your tummy and using a type of x-ray called fluoroscopy. It's a live x-ray where it is used to locate the space in between the two vertebral bones where that space is identified, and after cleaning your back and after hooking you up to different monitors to make sure that you stay safe, sometimes they may use a little bit of sedation if you are a very anxious type of person. If not, for the most part, a little bit of a local anesthetic injection is sufficient to numb the skin in that area. Once when the skin is numbed, epidural space is reached using a different type of needle. And once when the epidural space is reached, if you are not allergic to iodine, you will receive a contrast material that is injected in through that. Once when that is injected, it will spread in the epidural space where your doctor will take the picture. Once when the picture is taken, both from top to bottom and from the sideways by rotating the fluoroscopy, after confirming the position of the needle, your physician will inject a mixture of a local anesthetic and a steroid, which is usually long-acting steroid that will help the situation. So once when this is done, the needle is taken out and you are brought to the recovery room, and once when they deem that you are stable, you are discharged home with an attendant. So this is the epidural steroid injection in a nutshell. What are some of the things that can go wrong with this? Some of the things that can go wrong with this are infection, pain at the site of injection, worsening of the pain, sometimes an accidental spinal fluid leak, and developing what is called a spinal fluid headache. Where if this happens, identifying them ahead of time, educating the patient how we go about addressing them goes a long way. Ignoring them and neglecting them is not a correct way to treat. How do we do that? So if there is an accidental spinal fluid leak, having to lie down flat, taking a large amounts of caffeinated fluid like Mountain Dew or Diet Mountain Dew or coffee will take care of most of the spinal fluid leak headache. On a rare instance, if this is not adequate, then your doctor will take your own blood from your vein and then inject into the epidural space, where it goes and helps with the spinal fluid headache. Sometimes the pain after the epidural steroid injection may increase. It is normal, it is expected for the pain to increase for the first 24 to 48 hours, but thereafter it decreases. At no point in your time your legs should be so weak or numb that you cannot use it. If that were to happen, it is imperative that you get hold of your doctor immediately. If you cannot get in touch with your doctor, you have to call or go to the emergency room right away. This video is purely meant for your education. If you need further information, please contact your physician. And this is Dr. Nagaraj Kikkeri from North Texas Team Care Surgery Center regarding epidural steroid injection. Thank you very much for watching. If you want to reach us, you can also reach us at nttcsurgerycenter.com.